And whenever you guys are ready, Kate, you can start whenever you're ready.
Hi, it's Kate again, producer of the RMBC Life podcast. We're live from Infinite Strength Conference in New Haven, Connecticut. I'm so happy to be here today with Dr. Nancy Borstelmann. She's the Chief of Family Behavioral Health Service and Hematology Oncology at Yale. And Dr. Nancy, receiving a cancer diagnosis is very devastating, not only for the patient, but also for the family and even friends. And we just heard a wonderful panel discussion on living with MBC and raising children. What were some of the key takeaways that we can let our listeners hear today?
Sure. Thank you so much for having me. There were so many really rich comments, suggestions, advice given by everyone, but I would say some of the key takeaways are around honesty and open communication and the value of that for not only children and other family members, but also for the patient who's experiencing cancer themselves. Cancer is complex and disruptive, has a lot of impact not only on the patient but on everyone who is in their family and their support network. It's a really hard secret to keep. Cancer care can require a lot of trips into a cancer center. There can be observable changes. So especially with children and others around you, they may notice that there's something different. So it can be burdensome and difficult. Also, the worst way to hear about what's really happening in your family is to overhear it or to hear it from somebody who's not your caregiver, parent, directly. And that's something that children say. If you're looking at studies of how children and families, one of the really important things is, I heard this, I felt included. I wasn't trying to make sense of something that was so confusing just on my own. So I'd say one key takeaway was honest, open communication and trying to set a foundation of having, even if it's small conversations or updates, but building that foundation so that over time it's okay that we're talking about this.
Yeah, that's so important because, children, obviously we have birth to 21, right? Or so, and even older, right? Living with metastatic breast cancer, we can have different phases that we're going through. We're doing like treatments, and then maybe we're stable for a little while and we're okay, and then we have maybe perhaps a change in treatment because we have a progression, and we have, parents as patients, sometimes we have stress, and I think our children see our stress, and we don't realize that power that they may be little or young, and you don't realize the impact that we're having on our children. Do you have any recommendations as to what patients can do at that point when they're maybe transitioning from something and changing to something different, like when their children developmentally go from maybe a youngster to elementary to middle school, or even middle school to high school, because the way you talk to them will change.
That's
and
right.
how much they can understand.
Exactly. Right. Now you're speaking about the impact of development. So just the lens through which a child or an individual looks at the world and understands the world. So as you mentioned, if it's an infant or a little one, a toddler, they are very sensitive to the environment and can pick up changes that you may think you're doing what you usually do, but they can sense that. So, and the same with other kids in the family, observing, but also feeling it and sensing it. So, you're, I think, speaking to what can you do. So, children often do as you do. So,
Yes.
I think talked about on the panel was, you know, how do you, how do you take a step back and think about how am I processing what's going on? You know, have I taken the time that I need before I try to talk to the kids about it or figure out how we're gonna manage the calendar of events, or whatever's happening, but really, take that time, or some time, whether it's talking to trusted family member, spouse, friend, therapist, whoever, or somebody at your cancer center, but really taking that time to figure out where am I in this, you know, how am I feeling, because you have needs too, and as you address those, you'll be more able to support your kids wherever they're at, no matter what their age.
Yeah, so important. You know, our cup needs to be full before we can help others. So that's such an important message. And the panel was just fantastic. Thank you so much for joining me here.
Yeah.
This was a wonderful interview, and it was so nice to meet you and speak with you. Thank you so much.
Thank you. It's been an honor.